Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Kelly Bain. She's a family physician, and today's Kevin MD article is Why Physician Business Literacy Matters. Kelly, welcome to the show.
Thank you for having me.
All right, let's start by briefly sharing your story, and then we'll jump right into your article and explain about why you wrote it in the first place.
So, I'm a family physician. I've practiced for over 30 years, and I think about my story in three parts, if I may. My first I call phase one, where I didn't know what I didn't know. So, I came from a rural area, wanted to go back and practice in a rural area, and it included a full spectrum of family medicine and OB. So I did. And I just wanted to practice medicine. I didn't think I needed to or did not want to mess with managing my practice or really understanding the business aspects. But what I found was in that employed position and with my lack of business education, I really had no control over my volumes. I didn't know what kind of contracts I was in and what type of patients I was supposed to see, who my call coverage was, how money flowed in my clinic. Was I making an adequate amount to cover my expenses? I had no idea. And what I learned as I experienced this was that really was uncomfortable. I wanted to have some input into how my practice was managed. There were some circumstances that, besides that, that led to my leaving in 3 years, but really I wanted to find a private practice or a circumstance where I could learn more about how the business of healthcare was done and how it could impact my practice. So, phase two of my life was I joined a large private multi specialty group, which had been involved in value based care and value based contracting since the early 2000s. As you know, that's when the precursor to current Medicare Advantage came about. And really, before it was cool, we were doing value based care with going into homes,
Hmm.
managing transitions of care, having nurse practitioners who went into skilled facilities, making sure our patients got their preventative measures so that I didn't have long term healthcare complications. And I was really blessed to have a group of men and women physicians who found the value in both business and our medical excellence. But success sometimes leads to takeovers, right? So we were
Yeah.
purchased, and we were purchased by a large non for profit medical system in the region. And things changed once again. I was for the first time on a productivity payment system. Again, I didn't have control over my patient panel. There was a push toward volume. And I tried to get involved in things like managing our care management team, working with finance committees, and getting involved with medical directing. But I found I didn't have the skill set to understand all
Mm.
the things I needed to be impactful. So I went back and got my master's in healthcare administration. Um, and about the time COVID hit in 2020, I decided I wanted to get back to my roots and go back into a circumstance where physicians were directing the clinic, both from the business and the clinical excellence side. So then I joined ESSA Health for the last 3 years of my clinical practice. So that's kind of my background.
All right. And one of the things that struck me is that more and more physicians, as you know today, they are going away from private practice. The numbers of private practice clinics are slowly dwindling. You mentioned that you did not have the business knowledge to really have that autonomy and empowerment when it comes to the patients you were seeing and the numbers behind how you're paid and compensated. For the average physician practicing today, do they need to get a MBA or Masters of Health Administration to get that business knowledge in order to thrive in our current healthcare system? If you needed a master's degree, what hope do traditional physicians who don't have any business background have?
Yeah, I don't think getting a master's degree is necessary. I was moving toward more administrative roles
Hmm.
and found it useful in that, but I think we can start much more basic than
Hmm.
that. And the key is to start somewhere. Start with beginning to understand your financials, start to understand how your contracts work. start to understand money flow within your office. So there's many things you can do to start to educate yourself in the business of healthcare.
And you talk more about that, of course, in your Kevin MD article, Why Physician Business Literacy Matters. For those who didn't get a chance to read your article, just tell us what it's about.
Sure. So the article is rooted in what I do now. So I am a faculty physician with Surround Care Academy, and Surround Care Academy is a division of Navis Healthcare. And we are creating curriculum that does exactly what we're talking about: educate physician and physician leaders in the business of healthcare, the environment that we work in, who are the payers, how is it funded, how is policy made, what is a value based contract, how do you provide that type of care, what does it mean when we work in a hybrid payment model with both fee for service and value based care contracting. And so we provide those basic business knowledge elements, historical elements, and then some more detailed things. We can dig down into how do you perform well in a value-based contract? What's the medical loss ratio and star rating? So get those terminologies and education to our providers.
So it sounds like they have to learn a whole new vernacular, right? And that's one of the things that I often hear from physicians. They don't necessarily need to get a master's in business administration, but sometimes speaking in the language of business administrators sometimes can be helpful in terms of influence and communication, right?
When you are sitting in the boardroom or in committee meetings with administrators, being able to communicate in the language that they use is very, very important to be heard. But I think the other value that physicians bring in that is our clinical lens. And we know how the decisions being made about policies or workflow are going to impact our patients and are going to impact our fellow providers and how we provide care. And that is just invaluable in driving the future of healthcare.
As I alluded to earlier, the majority of physicians are employed physicians, similar to the situation you were in when your multi-specialty practice was bought by a nonprofit. A lot of physicians work for large medical institutions and hospitals. Give us some case studies and specific examples of how some of this business knowledge that we're talking about today, the business knowledge that physicians need, how is it going to affect them on a practical level? What would be some examples of that?
So employed physicians often feel that they don't have control
Yep.
and that everything is on their shoulders. And I think that knowledge of business and how you can work cooperatively and work with your employer to help create those teams of care is one aspect that can help lift burden off of the shoulders of physicians. And when you lift some of those things off the shoulders of physicians, they can become more efficient. Often we're doing tasks that can be done by somebody else that our team is not working to top a license. And so you can have folks in your office that by your workflows, they're setting up your visit, doing the pre-work. They take the initial HPI. You can go in and have more time with your patient. They put in orders. They do gaps in care work. So you can spread that work that sometimes seems like it's all on the physician's shoulders out among your team and make the argument with your business leaders, your administrators, about why that efficiency is good and why it brings value to their business.
So sometimes in order for physicians to improve their workflows and work environment, again, they need to speak in that business language of efficiency to convince the business leaders to make those changes in the first place, right?
Yeah, I think that's a good way to say it. I think another practical example is often we feel like we're being asked to do a lot of things that are just check the boxes or they don't make a lot of sense. And so if you understand what you can do with some things like, let's use coding as an example, right?
Yeah.
If you understand that if you're in a, let's say, Medicare Advantage program, how you're reimbursed for that patient care is based on how you code, not just CPT code, but what we're talking about now is your HCC coding. And so you want to represent the full spectrum of disease that that patient has. The way you put the codes in and accurately can make the 67-year-old look like a guy who's out playing tennis every day, or the guy who's in a wheelchair with an ulcer on his heel and badly controlled diabetes. So if you use the correct code versus the incorrect code, you paint a picture of the healthcare complexity of that patient, and those codes are multipliers to the number of dollars that are allocated for that patient's care, trying to reflect future cost of care. So when I bring that to physicians and they understand that piece helps bring the dollars into the system to care for their patients, they're suddenly more interested in it. I think then another piece that is not always well understood is when we look for disease and find it early, there's literature that shows that those patients have slowed progression of their disease because they're getting the care and the resources that they need. And so we improve quality outcomes. And when we look at the whole patient, then and not just say the complaint that they come in for
Yeah.
with that day, we can change that prognosis for them over time. So all of those things are very appealing to physicians in providing quality care for their patients.
It sounds like a lot of this knowledge is given to physicians after the fact, after training, after they've been practicing for a few years and realize they're deficient in this business knowledge. Is it safe to say that the majority of physicians entering the workforce today, the newly graduated residents, they don't have any of this knowledge whatsoever?
I think that's safe to say. Most residency programs do not have any business curriculum. If they do have some curriculum, it tends to be focused on how you get your job, reading contracts for getting your job, maybe a little bit about setting up a practice, but very little bit about how, say, healthcare is funded. Who are the payers? How do contracts work? How does funds flow in your office? What does it mean when you have to have quality metrics, and how does the star rating impact dollars coming back into your clinic? How does that impact your patients? How does it impact patient satisfaction? So there's a lot of dots that get connected when you start to understand the business behind healthcare that helps you feel some control back into your practice life. And there's an entrepreneurial spirit to that. And I know from listening to a number of your podcasts that that's something that I think is very important to providers now is how do I have some ownership? How do I have some control back over my practice life?
And given that the majority of new physicians don't have the business knowledge that we're talking about, what does that say for the potential future of our profession as it comes to physician autonomy if they don't gain this knowledge later on in their careers?
I I don't think we can underestimate the value of having business education. Physicians need to take positions of leadership, and you don't have to be practicing 10 or 15 years to do that. You start small and you start to learn what you can in the time that you have. But if we don't, we're not going to be the advocates that our patients need us to be. We're not going to be the advocates for our fellow providers to change or transform healthcare for the future.
And where can physicians get started? I know that you mentioned a few resources, but for those physicians listening to you and maybe this is a
Mhm.
light bulb moment for them, give us advice on terms of how they can get started.
Yeah, I think often our professional organizations have materials. I know mine, the AAFP, there's even a whole journal geared toward management of your business in addition to the regular AAFP journal. So your professional organizations will have that information. The AMA has a lot of information in their Steps Forward program. My organization, Surround Care, we have tried to create a set of curriculum geared toward adult learners It's a combination of live or live virtual education that does the foundational education, say, around what is value based care and early disease recognition, the foundations of business of healthcare, what is that environment like? And then there are shorter pieces that you can do in a LMS module on your own time, divided into 5 to 10 minute segments that allow you to dig deeper into a particular topic and get more detailed information. So we have a whole catalog of those kinds of information. So whether your organization would choose to do something like what we provide, or you're on your own doing that, there are resources out there for physicians to gain business knowledge.
We're talking to Kelly Bain, family physician. Today's Kevin MD article is Why Physician Business Literacy Matters. Kelly, let's end with take-home messages they want to leave with the Kevin MD audience.
Take-home messages. Let me think for a second. I think that doctors are full of great ideas. They often need some additional education to express those and have them be heard by their healthcare systems that they work for. And so they have to help their administrators understand how to connect the dots as well. And in doing so, we're going to improve the future, making better choices with the limited resources that we have to reduce waste, improve value, improve access, and move from, instead of feeling like victims of the circumstances that we are in, to being a performance-minded entrepreneur. And we're rising to those healthcare challenges. And that's really what our country needs to improve our healthcare system.
Kelly, thank you so much for sharing your perspective and insight. Thanks again for coming on the show.
Thank you so much.